Right now, as you are watching this video, 1 in 3 adults has high blood pressure. Most of them have no idea. No chest pain, no dizziness, no warning signs of any kind. And that is precisely what makes hypertension so dangerous. It does not announce itself. It simply works in the background, silently damaging your arteries, straining your heart, narrowing the vessels feeding your brain until one day it is no longer silent. A stroke, a heart attack, kidney failure, and by then the conversation has already changed. So if you are watching this right now and you have been told your blood pressure is elevated, or you are simply smart enough to be proactive about your cardiovascular health before a doctor gives you bad news, this video is exactly what you need to watch, because I'm going to walk you through 3 evidence-based techniques that have been clinically studied and shown to produce real, measurable reductions in blood pressure. Not supplements, not detox drinks, not the kind of vague lifestyle advice you have heard 100 times. These are specific, actionable techniques. And by the end of this video, you will know exactly how and why each one works at a physiological level. My name is Dr. President. I am a board-certified cardiologist, and I have spent over a decade managing patients with hypertension ranging from mild elevation to hypertensive crisis. I have seen what works and what does not. And I want to be very clear before we go any further. These techniques are adjuncts to medical care, not replacements for it. If your blood pressure is severely elevated, if you are already on medication, or if you have been diagnosed with any cardiovascular condition, please work with your physician. What I am sharing here is designed to complement good medical management, not circumvent it. With that said, let us get into it. To understand why these techniques work, you need to understand the basic mechanics of blood pressure. Blood pressure is simply the force your blood exerts against the walls of your arteries as your heart pumps it through your body. It is measured in 2 numbers: systolic, which is the pressure when your heart contracts and pushes blood out, and diastolic, which is the pressure when your heart relaxes between beats. Normal is generally considered anything below 120/80. Stage 1 hypertension begins at 130/80. Stage 2 begins at 140/90. And hypertensive crisis, which requires immediate medical attention, is anything above 180/120. Now, blood pressure is not static. It fluctuates constantly throughout the day based on your activity, stress level, sleep, hydration, and a dozen other variables. What we are trying to do with the techniques I am about to share is shift the baseline. Lower the average pressure your arteries are exposed to over time, reduce the load on your heart, and improve the overall responsiveness of your vascular system. There are 2 primary mechanisms through which blood pressure is regulated in the body that are most relevant to what we will be discussing. The first is the autonomic nervous system, specifically the balance between the sympathetic branch, which you know as the fight or flight system, and the parasympathetic branch, which governs rest and recovery. When your sympathetic system is dominant, your heart rate increases, your arteries constrict, and your blood pressure rises. When your parasympathetic system is dominant, the opposite happens. The second mechanism involves vascular resistance, how stiff or relaxed your blood vessels are. Stiffer vessels mean higher resistance and higher pressure. The techniques I am going to share with you directly influence one or both of these mechanisms. They are not gimmicks. They are grounded in cardiovascular physiology, and the data behind them is compelling. The first technique is slow, controlled breathing, specifically a pattern called resonance frequency breathing. sometimes also referred to as coherent breathing. This is one of the most well-studied non-pharmacological interventions for blood pressure, and the results across multiple clinical trials have been consistent and significant. A landmark meta-analysis published in the Journal of Human Hypertension analyzed multiple randomized controlled trials and found that slow breathing exercises performed regularly can reduce systolic blood pressure by an average of 6 to 8 millimeters of mercury and diastolic by 3 to 4 millimeters of mercury. To put that in perspective, some first-line antihypertensive medications produce reductions in a similar range. So this is not a small effect. This is clinically meaningful. Here is the physiology behind it. When you breathe slowly and deeply, specifically at a rate of about 5 to 6 breaths per minute, something remarkable happens in your cardiovascular system. Under normal breathing, which averages around 12 to 18 breaths per minute, the baroreflex, the system your body uses to automatically regulate blood pressure, operates somewhat inefficiently. When you slow your breathing to that 5 to 6 breaths per minute range, your inhalation and exhalation begin to synchronize with your heart rate in a phenomenon called heart rate variability coherence. During inhalation, your heart rate naturally speeds up slightly. During exhalation, it slows down. At slow breathing rates, these oscillations become amplified and synchronized, which significantly enhances baroreflex sensitivity. And when baroreflex sensitivity improves, your body becomes far more efficient at detecting and correcting elevations in blood pressure in real time. Think of it as recalibrating the thermostat that controls your vascular system. Additionally, slow diaphragmatic breathing activates the vagus nerve, the primary nerve of the parasympathetic system, which directly signals your heart to slow down and your arteries to relax. This is not a theoretical mechanism. This is measurable in real time with heart rate monitors and arterial blood pressure cuffs. So how do you actually do this? Sit comfortably, either in a chair or on the floor. Place one hand on your chest and one hand on your abdomen. Your goal is to breathe with your diaphragm, meaning your belly should rise on the inhale and fall on the exhale, while your chest remains relatively still. Inhale slowly through your nose for a count of 5 seconds. Then exhale slowly through your nose or through pursed lips for a count of 5 seconds. That is one breath cycle, and it puts you right at approximately 6 breaths per minute. Do not strain. Do not force the breath to be enormous. This is about rate, not volume. Practice this for a minimum of 10 minutes per day. Research shows that consistency matters more than duration in any single session. Some of the most impressive blood pressure reductions in clinical studies came from participants who practiced this for 10 to 15 minutes twice daily over a period of 4 to 8 weeks. There is also a device called Respirate that guides this breathing pattern and has FDA clearance for blood pressure reduction, but you do not need it. Your own breath and a timer are sufficient. One important note: do not perform this exercise while driving or operating any kind of machinery. Some people experience mild lightheadedness when they first begin slow breathing practice, simply because their body is not accustomed to the altered carbon dioxide balance that occurs with very slow breathing. That adjusts within a few sessions. Start seated and in a safe environment. The second technique is something that surprises most of my patients when I bring it up, because it sounds counterintuitive, and that is isometric exercise. Specifically, isometric hand grip exercise, and wall squat holds. Isometric exercise refers to muscular contractions that occur without any joint movement. You are contracting the muscle against a fixed resistance, holding that contraction, and then releasing. You are not performing repetitions. You are not moving a weight through a range of motion. You are simply creating sustained muscular tension. And the data on isometric exercise for blood pressure reduction is remarkably strong. A 2023 systematic review and meta-analysis published in the British Journal of Sports Medicine analyzed 270 randomized controlled trials involving more than 15,000 participants and compared the blood pressure lowering effects of different forms of exercise: aerobic exercise, dynamic resistance training, high-intensity interval training, and isometric exercise. The conclusion was striking. Isometric exercise produced the largest reductions in blood pressure of any exercise modality studied. Systolic blood pressure dropped by an average of 8 millimeters of mercury, and diastolic by approximately 4 millimeters of mercury. Those are numbers that rival medication in patients with mild to moderate hypertension. The physiological explanation for why isometric exercise has such a powerful effect on blood pressure comes down to several converging mechanisms. During an isometric contraction, you are compressing the blood vessels within that muscle, temporarily restricting blood flow. When you release the contraction, there is a reactive hyperemia, a rush of blood back into the muscle. This repeated pattern of occlusion and release acts almost like a mechanical stimulus on the vascular endothelium, the inner lining of your blood vessels. Over time, with consistent practice, isometric training improves endothelial function, increases the production of nitric oxide, which is a potent vasodilator, and reduces arterial stiffness. The result is a vascular system that is more pliable, more responsive, and operating at lower baseline resistance. Lower resistance means lower pressure. The protocol that has been most extensively studied and validated in clinical trials is simple. For isometric hand grip, you need either a dedicated hand grip dynamometer, which you can purchase for a modest cost online, or, in the absence of that, even a rolled up towel or a tennis ball can serve as a rudimentary substitute, though a calibrated device is more effective because you need to work at approximately 30% of your maximum voluntary contraction. Here is the standard protocol. Squeeze the grip at 30% of your maximum effort for 2 minutes, then rest for 1 minute. That is one set. Perform 4 sets per session, alternating hands. 3 sessions per week. The entire session takes roughly 12 minutes. That is it. 12 minutes, 3 times a week, for blood pressure reductions that researchers are now comparing to medication in mild hypertension. If you do not have access to a hand grip device, the wall squat, also called the wall sit, is an excellent alternative. Stand with your back flat against a wall, feet shoulder width apart and roughly 2 feet from the wall, and slide down until your thighs are parallel to the floor. Essentially, a seated position with no chair. Hold that position for 2 minutes, rest for 1 minute, repeat 4 times. The same physiological principles apply. You are creating sustained isometric tension in the large muscle groups of the lower body, and the vascular adaptations follow accordingly. I want to address a concern that patients often raise here. Is it safe to do isometric exercise if I already have high blood pressure? During the exercise itself, blood pressure does transiently rise during the contraction. That is normal and expected, and it is part of the mechanism. However, The chronic adaptations that develop over weeks of consistent practice lead to sustained reductions that far outweigh any transient increase during the exercise session. The clinical trials that established this protocol enrolled patients who already had elevated blood pressure and found it both safe and effective. That said, if your blood pressure is severely uncontrolled, meaning systolic above 160 or diastolic above 100, consult your physician before beginning any new exercise program, isometric or otherwise. The third technique requires a closer look at something you do 3 times a day, every single day, and that is eating. But I'm not going to give you a vague recommendation to eat healthier. I want to get specific about 2 dietary modifications that have the most robust clinical evidence for blood pressure reduction and explain exactly why they work at a mechanistic level. The first is sodium reduction. I know, you've heard this before, but the reason physicians keep repeating it is because the evidence is overwhelming and most people still consume far more sodium than they realize. The current guideline recommendation for individuals with hypertension is to limit sodium intake to under 1,500 milligrams per day. The average adult in most Western countries consumes between 3,400 and 3,600 milligrams per day, more than double that limit. And the most important thing to understand about dietary sodium and blood pressure is that the relationship is not uniform. Roughly 50 to 75% of people with hypertension are what we call salt sensitive, meaning their blood pressure responds significantly to changes in sodium intake. In these individuals, sodium restriction can lower systolic blood pressure by as much as 5 to 10 millimeters of mercury. The mechanism is straightforward. Sodium is osmotically active, which means it draws water into the bloodstream. Higher sodium intake leads to greater fluid retention, which increases blood volume, which increases the pressure your heart must generate to push that larger volume through your arteries. Reducing sodium intake directly reduces that fluid load, decreasing blood volume and in turn reducing pressure. Additionally, chronically elevated sodium disrupts the function of the sympathetic nervous system and impairs the kidney's ability to excrete sodium efficiently, a process that compounds over time. Reducing sodium intake reverses these effects. The practical challenge is that most dietary sodium does not come from the salt shaker on your table. Approximately 70 to 75% of sodium consumption in most diets comes from processed and restaurant foods. Bread, canned soups, deli meats, sauces, condiments, cheese, frozen meals. These are where sodium accumulates, often invisibly. A single serving of canned soup can contain 800 to 1,000 milligrams of sodium. A restaurant meal can contain your entire daily limit in a single dish. The intervention here is not to cook bland food. It is to read labels, prioritize whole foods that you prepare yourself, and use herbs, spices, citrus, and vinegar as flavoring instead of salt. When you cook at home, you control the sodium. That is the single most effective dietary change you can make immediately. The second dietary modification, and this one is often underutilized even by patients who are excellent about sodium, is increasing potassium intake. Sodium and potassium are physiological counterweights. Potassium promotes sodium excretion through the kidneys, relaxes arterial smooth muscle, and improves the sensitivity of the baroreflex. The relationship between dietary potassium and blood pressure is dose-dependent, meaning the more potassium you consume within a reasonable range, the greater the blood pressure benefit. A meta-analysis of randomized controlled trials found that increasing potassium intake was associated with reductions in systolic blood pressure of approximately 4.5 millimeters of mercury and diastolic by 2.5 millimeters of mercury in people with hypertension. The recommended intake for potassium is approximately 3,500 to 4,700 milligrams per day for adults with elevated blood pressure. Most people consuming a Western diet get far less than this. The best dietary sources of potassium are foods that are simultaneously low in sodium, which makes them doubly valuable for blood pressure management. Bananas are the commonly cited example, but they are actually not the highest potassium foods available. Cooked white beans and lentils, sweet potatoes, spinach, avocado, salmon, plain yogurt, and edamame are all significantly richer in potassium than bananas and should form the backbone of a blood pressure conscious diet. These are not exotic superfoods. These are accessible, affordable, practical foods that you can incorporate into your meals starting today. I also want to briefly mention the DASH diet, Dietary Approaches to Stop Hypertension, because it represents the most comprehensively studied dietary pattern for blood pressure management in clinical medicine. It is not a fad. It was developed by the National Institutes of Health specifically through controlled clinical research. And the DASH trial found that adherence to this dietary pattern reduced systolic blood pressure by up to 11 millimeters of mercury in hypertensive individuals. The DASH diet essentially operationalizes everything I have just described. It is high in fruits, vegetables, whole grains, legumes, and low-fat dairy, moderate in lean proteins and healthy fats, and explicitly low in sodium, saturated fat, and added sugars. If you want a structured framework to build your diet around rather than making individual food decisions, the DASH diet is what I recommend to my patients, and the evidence behind it is unambiguous. Now, I want to be honest with you about something that the wellness industry tends to obscure because I think clarity is more valuable than enthusiasm. The techniques I have described, slow breathing, isometric exercise, and dietary modification, are not miracle cures. They are powerful tools, but they require consistency and time to produce their full effect. Most of the clinical trials that demonstrated significant blood pressure reductions ran for 4 to 12 weeks of consistent practice. You will not do one 10-minute breathing session and see your blood pressure permanently drop. What you will do is build a practice, and over weeks, your vascular system will respond. The endothelium will become healthier. Your baroreflex will become more sensitive. Your arteries will become less stiff. And those changes will be reflected in your blood pressure readings. The other thing I want to be clear about is measurement. If you are monitoring your blood pressure at home, which I strongly encourage, you need to measure correctly for those readings to be meaningful. Sit quietly for 5 minutes before measuring. Sit with your back supported, your feet flat on the floor, your arm at heart level. Do not talk during the measurement. Do not measure within 30 minutes of exercise, caffeine, or a meal. Take 2 readings, 1 minute apart, and average them. Measure at the same time each day, ideally morning and evening. If you are doing these consistently, you will have a genuinely accurate picture of how your blood pressure is trending over time, and you will be able to see whether these interventions are working for you specifically. There is one more thing I need to address before I wrap up, and it is about the role of sleep. I am not listing it as a 4th technique because the scope of this video is 3 focused, actionable interventions. but sleep is too important to omit entirely. Poor sleep, specifically less than 7 hours per night, or disrupted low-quality sleep, is an independent risk factor for hypertension. Obstructive sleep apnea in particular is one of the most common but underdiagnosed causes of resistant hypertension, blood pressure that does not respond adequately to medication. If you snore loudly, if your partner has observed you stop breathing during sleep, if you wake unrefreshed regardless of how many hours you sleep, please speak to your physician about a sleep study. Treating sleep apnea in a patient with hypertension can produce some of the most dramatic blood pressure reductions I ever see in clinical practice, sometimes more than any single medication or lifestyle intervention on its own. Let me bring all of this together. High blood pressure is not an inevitable consequence of aging. It is not something you simply have to accept and manage with medication indefinitely. For many people, particularly those in the earlier stages of hypertension, the combination of evidence-based lifestyle interventions, practiced consistently and with the same seriousness you would give to a medication, can produce clinically meaningful reductions in blood pressure and, in some cases, prevent or delay the need for pharmacological treatment. The three techniques I have covered today, slow resonance breathing at 5 to 6 breaths per minute for 10 to 15 minutes daily, isometric hand grip or wall squat exercise performed 3 times per week, and targeted dietary modification, emphasizing sodium reduction below 1,500 milligrams per day and potassium optimization, are not experimental. They are not alternative medicine. They are validated, evidence-based interventions that I recommend to my patients and that are endorsed by leading cardiovascular organizations around the world. Start with one. Pick the technique that feels most accessible to you and build the habit before adding the next. Sustainable change is always more effective than an aggressive overhaul you abandon in 2 weeks. Track your blood pressure at home using a validated cuff device. Bring your log to your next physician appointment. Have the conversation. Be an active participant in your cardiovascular health. If you found this video genuinely useful, please share it, not for the algorithm, but because there are real people in your life who have high blood pressure and have not yet been given information this specific and this actionable. Hypertension is largely a silent condition, and the people who would benefit most from this information are often the ones least likely to search for it. You can change that simply by sharing this video. Subscribe to this channel if you want evidence-based cardiovascular health information delivered clearly, without exaggeration, and without anything being sold to you. Drop your questions in the comments. I read them, and your questions often become the topics of future videos. Take care of your heart. It does not get a day off, and neither should you.